Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center reporting for the week of January 17th, 2022. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Worldwide and nationwide, cases are continuing to climb at a pretty steep rate. We're pretty much seeing almost a vertical line of increase of cases. There are, though, a few places that were hit with Omicron earlier than we were, who do potentially appear to be plateauing a bit. And this includes South Africa and the UK, and even maybe in New York, as was announced by their governor. But nationwide, we're not there yet, and certainly here, we don't appear to be there yet either. Here in Alameda County, you can see that our line is going pretty much straight up there. That those gray lines over to the right are data that is incomplete and they're still updating it, but tentatively it does appear to be continuing to increase at this time. Also, a familiar picture here with the case positivity rates. This is a 28-day positivity rate. That's the way that they're showing it on the county dashboard. But we can see the same zip codes lighting up, as you're probably familiar with from previously, where East Oakland is the hardest hit with 94621 at over 29% positivity rate, and 94603 up close to 26% positivity rate. And really, all the areas across the county are pretty high, well above that 5% mark that we talk about, above which we really are not doing enough testing to know exactly what's going on, but we do know that we are certainly being hit with quite a bit of disease transmission here. And unfortunately, this is also translating into increases in hospitalizations in particular. We've got 428 individuals hospitalized with COVID-19. And if you look at the sort of the winter surge, the worst day in our winter surge, we had 454 individuals in the hospital. So we're getting close to some of the worst days from last winter, our worst surge. And so that is certainly concerning, particularly given that also this line appears to be going quite straight up. The one thing that I'll say is a positive thing is that back on that worst day, which was actually December 31st, 2020, there were 115 people in the ICU, and right now we've got 62 people in the ICU, so that's quite a bit less, even, comparing to a pretty close number of people in the hospital overall. So don't have enough information to really interpret that. The worst day in the ICU actually trailed behind the worst day in the hospital by a few weeks, and so that was somewhere in mid to late January of 2021. So we may also be heading towards increases in ICU bed days. We'll just see as time goes on, and as we all know, deaths are typically lagging behind the increase in hospitalizations by a couple of weeks, a few weeks, and so we will just be keeping an eye on that. I know certainly for our amazing teams that have been leading our work in terms of notifying people that they're positive with COVID or doing the case investigation and contact tracing. We are also back to hearing difficult stories of families that are being hit hard, loved ones who are dying from COVID-19 or are being hospitalized. And so just want to take a moment to thank all of our amazing teams that are doing that frontline work, and really give a special shout out and just note of gratitude to colleagues that are working in the hospitals, working in the ICUs, that are working to save lives, that are unfortunately also losing lives and having to tell family and loved ones devastating news. This is very, very difficult work. And certainly it is taking a toll on many of our healthcare workers across the country. And so just wanted to put out that note of gratitude at this time. In California, we are seeing that deaths compared to with unvaccinated compared to vaccinated, still just really a astounding difference here. This is reflecting the week of December 13th. This data on the state dashboard, which I've linked in the post, does lag a little bit behind, but really has been fairly consistently somewhere between 15 and 20 times more likely to die from COVID-19 than those who are vaccinated. This is quite compelling. I think there's just no question here that folks that do not have prior immunity from vaccination are much more likely to die. Still a little unclear the role of prior infection, although, as we're seeing now, prior infection with Delta is not seeming to be very protective from not getting Omicron, so we don't know what that means in terms of death. But this we do know that those who are unvaccinated are more than 20 times more likely to die from COVID than those who are vaccinated. And so this continues to be a very compelling piece of information to consider. A few updates that have occurred. I wanted to point out the CDC continues to update their updated quarantine and isolation guidance. And all I wanted to point out here, because it's just a little complicated here, and for all of the words that are here on the page, I think some important things are left out. But I wanted to highlight a couple of things that are new and included. And one is that the CDC is considering a person who has had confirmed COVID-19 within the past 90 days as not having to quarantine after exposure. So remember, quarantine is what you do after exposure, and isolation is what you do after you test positive. So, just as it relates to exposure, they are taking into account people who've caught COVID within the last 90 days. So, if you are exposed and not sure what to do, I've linked in the post to this chart here that you can take a look at. The other thing I wanted to point out is that the way that the CDC has decided that we're going to calculate isolation, which is a little new method here, is that the first day of your symptoms or the first day of your positive test is now considered day 0. So you don't start counting day 1 until the next day. So that first full day after symptoms or after your diagnosis. And so this is a little different. And they're still saying to isolate for at least 5 days. They are not recommending a test to come out of isolation, as I've gone over in some detail the last few weeks here. That would be the most advisable thing to do, and that also seems to be what the guidance here in the state and the county is generally saying, that it is most ideal if we have an antigen test that is negative to return. Many places, many countries, many workplaces are actually requiring 2 negative antigen tests to return. That is what we are doing at Roots, and certainly that is something to consider. But nonetheless, from day 6 to day 10, assuming that there are no symptoms, there is one thing missing, is what type of mask to wear. I think there is no reason to not specify in my mind that we should be talking about a high filtration mask, because we know that in those last 5 days there is a significant chance that you will still be contagious. So this part about shortening it to 5 days is really seeming to be in part so that we don't have labor workforce shortages, and it's trying to balance a number of things. But I think as it relates to the disease transmission process itself, there's every reason to believe that you could certainly still be contagious during days 6 through 10. Some people are even contagious beyond that. And so what we're suggesting at Roots for our staff, or what we're requiring actually, is that on day 6, if you have no more symptoms, you do a home antigen test. And if that is negative, then you come in and we repeat an antigen test. And if that is also negative, you are good to return to work. That is, of course, conservative. We are a healthcare establishment, so for other types of establishments, maybe this will be too conservative. However, I think it would behoove everyone, no matter what you decide to do about the testing to return part, to insist upon an N95 mask for those who are going to return to work in order to prevent more transmission at the workplace. Now I'm continuing to get questions on more than a daily basis about what tests to use when. I know I've gone over this in some detail, and we're really just trying to just equip ourselves with the best tools in order to answer these questions. You'll recall this graphic here, which kind of shows that after symptoms start and during the days when you're most contagious is when that antigen test is going to be positive, and the PCR test is going to be positive earlier, and it's also going to continue being positive later, even after you're contagious. So both of these tests have their advantages and their disadvantages, and so when to do what. And so this next graphic is very high level and hopefully just kind of gives an indication of how we're thinking about the best test to use and when. And that is especially at this time when we have some resource shortages. We just don't have enough, unfortunately, tests for everyone. And I'm hoping that that's going to be changing too soon. I will be talking about that in just a moment. But for right now, the way that we are kind of triaging the situation is that if you have symptoms or you were exposed, what to do next really can depend on whether you are in a high risk category or in a lower risk category. So if you're at high risk of a poor outcome, and this includes at this point unvaccinated individuals, it also includes those who may be vaccinated but not boosted, maybe vaccinated some time ago, or maybe vaccinated and boosted but have underlying conditions, are elderly, are immunosuppressed, and we're concerned that there may not have been an adequate response to the vaccine or boost. These would all be folks that I would consider in the high risk category. Also, those who are pregnant, and again, those who are unvaccinated includes those who are pregnant, includes those who are under 5 years old. So all of these individuals we would consider high risk. And why that's important is because it is really that much more critical that we get it right, and we get it right as soon as possible, because these are individuals who may require treatment, may be eligible for treatment. And so because it will change our behavior, we want to actually do the PCR test in those who are considered high risk. So if you have symptoms and you're high risk, we're going to want you to do that PCR. If you have symptoms, do it right away. If you're exposed, we're going to want you to do it in 2 to 5 days. And when you do it for the PCR test, really, it's going to turn positive fairly early. So in that 2 to 3 or 4 day window after exposure, it should turn positive. Of course, none of this is perfect, but this is sort of the best case scenario, because remember, some of the treatments, especially the pills, the Paxlovid, which are not quite readily available, but it is somewhat available. And so if you're in a high risk category and eligible for Paxlovid, then we're going to want you to advocate to get that treatment prescribed, but it has to be started within 5 days. And so that's why the timing of the testing is really important. Now, if you have symptoms or may have been exposed and you're in a lower risk category, so you're vaxxed, you're boosted, we think you've mounted a good response, then really the antigen test is a good place to start. If we want to be definitive about it, we're going to repeat it. But again, I think that that is a good place to start, and you're going to want to isolate certainly. If you have a positive antigen test, you really don't need to do anything else. You can believe that test. For going to a gathering or on travel, then the antigen test is something that you can do right up to the minute, because that is going to tell you right before you engage in this activity if you are contagious. Now, of course, that we have the caveat that some airline carriers and so forth are going to require a PCR test within 72 hours. And if we're doing it right, then that means you get the PCR test and then you quarantine yourself so that you don't actually catch COVID before you get on the flight. But this is obviously a major weakness of that policy. And so we're hoping to see that change. I would rather see an antigen test just happen right there in the security line before you get on the plane, because that is probably your best bet of not being contagious. But of course, I'm not in charge of the airline, so we have to see what their policies are. But definitely, in terms of your own knowledge and peace of mind before you're going into a gathering, before you're going into a space with others, then the antigen test right up to the minute before gathering gives you a reasonable indication of whether you are contagious or not. Last but not least, if you are recovering from COVID-19, again, remember the slide that I showed previously. There's really no reason to do a PCR afterwards, because that's going to continue to be positive long after you are no longer contagious. So really what we're going to want to do if we're trying to do a test to return to activities, then we are going to want to do that antigen test at least 5 days. Remember, day 0 is the first day of symptoms, so then count 5 more days, and then after that, you can do this antigen test. If it's negative, then that is reassuring. Many people are really recommending another negative test then 24 hours later, and so that would be the safest way to go. And also to wear a high filtration mask during that time frame. And that again is the antigen test. So as you can see, really, the PCR test is going to be most important for those who are high risk. But certainly after exposure, it is going to turn positive a little sooner than the antigen test. And so as supplies and access get a little bit better, then I think that we, will want to look at maybe making some adjustments. But right now, this seems like a prudent way to go given the sheer volume of cases and the backlogs that we are seeing in testing. Now, on that note, one thing that is positive is that the White House has announced a website where you can order 4 free antigen tests per household. They will be making that available to the public on Wednesday, the 19th. And so we will just have to see how that implementation goes. And we know that 4 tests per household is not enough for many households, especially those who are most at risk, who may have a number of people living within the household. And we know that just one incident of exposure, you can go through all the tests because you want to test everyone in the household, and then you'll be done. However, we are certainly hopeful that this is being coupled with other strategies, like hopefully driving the costs down and getting the insurance companies to pay for them. Still a little unclear as to how all of the reimbursement with the insurance companies is going to go, although it certainly has been talked about. That is what is going to be required. Also hoping that all of our community health centers and other community-based organizations will also get supplies to give out for people to take home. And so really just looking forward to the time where we just have more antigen tests than we know what to do with. Everyone's got them in their home. Everyone knows how to get them, and can easily get them at any time. So certainly, better late than never, and definitely order your 4 free ones for your household, and know that hopefully soon we'll all be able to have as many as we want in our house at all times. And then sort of these decisions about what to do become a little bit easier when we have good access. And I think one thing that is helpful is that if anyone in the household wakes up with a sore throat, doesn't feel well, just go ahead and don't even have to leave the house. Take the test. It's positive. Believe it. And that is a very, very, very helpful tool to have. Hopefully one day we'll also all have treatment in our medicine cabinet as well, because taken very early, it can really reduce the risk of a poor outcome. We are definitely nowhere near there yet, but we can definitely continue to hope. I also wanted to touch briefly on masks, and you know that I have been advising to use high filtration masks for quite a while now, myself and many other people in this work, because we know that those are the ones that provide filtration. And there was a time when there wasn't enough of it, but that time gratefully has passed, and there are plenty of high quality, high filtration masks on the market. I know that I recommended sites like projectn95.org to try different ones, try different N95s and see how they fit your face, because everyone's face is a little different and each one of these masks is a little bit different. They also have KN95s for children and for smaller faces, or sometimes they even have small size N95s. So try different things for different members of your family. You may find that each one of you has a particular one that works well for you. Community members who need N95s, Roots Community Health Center is giving away N95s. If you come during any of our testing clinic times, we are more than happy to give those out. But I was really pleased to see the state of California. This was actually a tweet. I couldn't find it anywhere else except on Twitter. But Twitter has turned out to be a very interesting resource for great COVID information. And state of California posted this infographic here: upgrade your mask. And I was so happy to see this, because the CDC just has been kind of mum on the topic, and that is a little frustrating, especially when they reduced their isolation times to only 5 days, and then said use a mask for days 6 through 10, but never specified what kind of mask. And I find that problematic. And from the best that I can gather, it's because there's just a lot of assumptions being made about what people will and won't do. And as you know, I just believe in giving everyone the best information we have and letting people make their decision from there, rather than trying to assume what people will and won't do. Because I think it is really problematic to not, relay our expertise on these things. And there is absolutely no question that the filtration mask, so the N95, which you can see here says best, the KF94 and the KN95s, which need to be really not fraudulent. So they need to be verified from a site like Project N95 that vets the masks. But at any rate, assuming they're legit, these are the ones that will filter out 94, 95% of the COVID-19 particles. Now, they do need to fit well. I went over in some detail about how to do a self-seal check, basically making sure that the air is not escaping out of the sides of the mask. But in essence, a well-fitting filtration mask is going to be your best bet, particularly if you're going inside into crowded indoor spaces, or if you're in that latter part of your isolation period, so that you're not transmitting to others. Surgical masks, and even just surgical masks and cloth masks, they really tend to kind of gape all around for the most part. I know we've all seen it. They say here a cloth mask is better than no mask. And certainly, if you're just outside and you're trying to prevent droplet transmission, I'm starting to call cloth and surgical masks outside masks or droplet masks, because they will stop the droplet transmission, which, if you're outside, that may be all you need. Because you're just worried about larger droplets kind of landing on you if you're in crowds and things like that. But with the contagiousness of Omicron and how it just seems to be like a poof of pollen, almost just a poof of smoke or a poof of dust, it's so highly contagious. We're hearing more and more about incidents where someone had it, was inside, left, and then someone else comes in. It's just still hanging there in the air. So all of those situations, you're just going to be better off with a higher quality, high filtration mask. And so, yes, you've got to consider comfort. If you're ripping it off your face after an hour, that's not going to work. You got to consider the fit. But filtration is absolutely important, and I don't think it does any of us any good to downplay that fact. And then we all just make the best decision that we possibly can. But know that if you're going to be going indoors in crowded environments, or if you are potentially contagious, the absolute best thing to do is to wear a well-fitting N95 mask. The last thing I wanted to touch on today was really about some considerations for the workplace because I've been getting a lot of different questions about this. And this is really not a straightforward or easy area. And so I'm going to talk kind of a little bit at a high level about this, about some things to consider. And this is whether you are the person in charge at the workplace, whether you are an employee. These are just things that I think we're all kind of grappling with right now as this pandemic continues to really evolve and we have to continue to function in the world. We can't shut everything down, but maybe sometimes we need to. But I think nonetheless, there are a number of things that we need to consider about our workspaces and about the different protocols that we have. And some of this is going to be driven by the same sort of I think, appetite for risk, if you will, or how conservative you want to be. And some of this is going to depend on what type of a business you have and how many people you have employed there. We know that there are certainly struggles within the schools where there's a high degree of mixing taking place and in many cases a low vaccination rate. So all of these things are just factors to consider in healthcare environments where almost everyone is vaccinated. There's certainly going to be perhaps less concern about people getting severely ill. However, shortages within healthcare cause critical issues, and so there are different considerations there. So just kind of wanting to walk through a couple of the areas that I think are important to think about. One is many workplaces, of course, still have staff that are working off-site, staff that work hybrid, and staff that are on-site all of the time. And so, as you are thinking about how you're going to manage positives in the workplace, which right now I can tell you, it seems like everyone is dealing with staff positives, staff exposures, being short staffed. And so, one thing to think about in order to be able to reduce the risk as much as possible of someone who is contagious being on site at work is to think about those who work in a hybrid environment. Can they go ahead and just keep that whole 10-day isolation period if they're feeling better? Perhaps that they can go ahead and just do the work from home for those days. And that way you don't really have to fuss with all of the testing to return and so on. You can go ahead and just let them do the entire 10-day isolation period off site and continue to work if they are feeling better, if their symptoms have resolved. So that is definitely one consideration that a lot of workplaces are doing and considering because it reduces the number of people on site around each other. It reduces the risk of someone transmitting during that day 6 to 10, and it also eliminates that need for that testing to return. And so COVID testing protocols, I think, are the next piece. And of course, for workplaces where everyone is not vaccinated, many of you are having staff to test every single week. I think that that may be, that may be reasonable depending on the type of work and the vulnerability of those that you work with and those you are around. However, remember that testing, once you test, is sort of too late. It's already kind of happened, and then you're having to work backwards. And so, certainly, having vaccinated staff we know is going to definitely protect each of them from bad outcomes and also reduce the risk that they're going to be out for a more prolonged period of time. But certainly, anyone at this point is vulnerable to catching Omicron. And so, how you want to do the testing protocols, is it every week for unvaccinated people and then just as needed based on potential exposure or symptoms? And so, really getting your testing protocols down and having them well understood, I think, is critically important. Understanding that every workplace, again, is very different, but you are going to want to be able to, once someone tests positive, then be able to go back and trace and figure out who else needs to get tested so that you can keep the maximum number of people safe. And so that brings me to sort of identifying your areas. What are your safe areas? What are your issue areas? And what can you do to mitigate issues in your issue areas? And so what I'm talking about here are those parts of your workspaces that maybe don't have good ventilation, those areas in your workspace where people congregate. I know that some places are still using lunchrooms and break rooms where people are in there together, unmasked. This is probably not advisable at all. This is the weakness when it comes to schools as well. It is difficult to prevent transmission in this setting. And it's also hard to trace unless you know exactly who's there when you are eating. So these are kind of the problem areas of most workspaces or many workspaces is those break rooms. And so you can consider using sign-in sheets. You can consider kind of cohorting, which I know some schools are probably doing. I'm not familiar with the public schools doing this, but having the same groups of people eating together every time so that if someone tests positive, it's much easier to then go back and say, okay, you were exposed to these individuals. And that kind of brings me to this piece about what is defined as exposure. And so the CDC definition of exposure is still pretty old. I'm not even going to state what it is, but I think in essence, we all know what exposure is. If you're unmasked around, and if two people are unmasked around one another, almost for any period of time at this point, that would be considered exposure. So the lunchroom, that is most likely going to be exposure. Also, if you're in an enclosed space together with a mask, especially if it's not an N95 or filtration mask, you're in a room together, a small room, let's say for over an hour, a couple of hours. So two people that share an office and maybe are wearing only surgical masks, that's exposure. And so I would consider that exposure and be testing those individuals. Now, how can you mitigate that? Well, there's a couple of things. One is you require N95s. And so requiring N95s in the workplace is what is happening in, I hope, in all healthcare establishments. But it can happen at any workplace as you so choose and as the supplies dictate. And so if everyone is wearing N95s when they're around one another, then you may not have any exposure even after someone is positive. And this is a huge reduction in risk. It's a huge reduction in hassle and a reduction in transmission. And so if it is something that you can kind of implement, then that will be how to keep everyone much safer is wearing N95 masks. Now, of course, if everyone has private offices, then you're in a luxurious, great situation and you can be in there by yourself and take the mask off, and that is great. But it's really those shared areas where we are concerned, and being able to retrace your steps back through those shared situations can be really challenging. So asking employees to recall who they were around in those situations is going to be an important piece of how we want to manage within the workplace. The other thing I wanted to say about your issue areas, your problem areas within the workplace, I've talked at length before about the CO2 monitors as a way of measuring, as kind of a proxy for ventilation within your spaces. But if you are a business owner and you're the one responsible, it really is important, I think, to assess well every space within your business, particularly where there are people congregating. And particularly where you may have also members of the public coming in. So how do you do this? So I think the CO2 monitor is kind of just a way for you to get a first pass and kind of understand where are the areas that are more problematic than others, and that would be where CO2 accumulates. It's only accumulating when you have poor ventilation. So those would be some areas to look at first. But someone who specializes in the engineering around HVAC systems can come in, they can assess, they have calculations that they do in order to assess ventilation and how the rate of essentially of air exchange within the area, and make recommendations on what it is you can do. I know that not everyone can afford to, it's just not feasible to put a new HVAC system in a building that doesn't currently have it. But if you do have an HVAC system, really important to make sure that it's exchanging the air at the appropriate rate, that it has the proper filter on there. And if not, get some recommendations on some mitigation strategies. I know we've installed windows in some areas, and sometimes you may need to put additional HEPA filtration units within areas, especially small spaces. And so doing what you can to really put in mitigation strategies in the problem areas within your workplace, I think, are really important. So thinking about your hybrid versus your on-site versus your off-site staff, defining those testing protocols and the return to work protocols, mask protocols, identifying your issue areas and taking steps to mitigate those, and then defining what it is that you mean by exposure and what that means within your workplace. So knowing who has shared offices, what's going on with the lunchroom or break rooms, and what it is that is exposure, so that when you do have a positive, you know who exactly to go back to and recommend that they also then get tested. And then, of course, the isolation and quarantine protocols. The link to the CDCs are in the post. And as I think I've made pretty clear here a few times, we can certainly go above and beyond those. We can put in place additional tests to return or strict guidance around masks. For example, if someone's in that day 6 through day 10 and you're going to have them come back on site, maybe they don't utilize the lunchroom or take off masks anywhere on site during those 10 days as an extra measure of safety. So none of these things are particularly easy to enforce or to implement, but these are all things that I think we do have a responsibility to think about. OSHA has put forward a number of guidelines, but I think when as a practical matter, knowing what to do, I think it's really important to keep navigating through all of these different things so that we can keep ourselves and our coworkers and the family members and households that they live in as safe as possible. Not to mention those of us who are working with members of the public are really wanting to be absolutely vigilant and certainly not be part of the problem. And so that is my update for today. Please be sure to eat a good balanced diet, get some good exercise, keep your stress levels down, get a good night's sleep, take a multivitamin, consider additional vitamin D supplementation, and please continue to stay safe out there. Thank you so much for joining us. We will see you next Tuesday at 10 a.m.